So hello everyone, this video is basically for your practice. So I want to practice you regarding the exam. So this is a one first mock, free mocks of the SDT and it is according to the MSRA National Oxford Handbook. So we will go through the questions straight. We will try to do it in 85 minutes. In the exam, you will get around 90 minutes. So in this mock, you will going to get a 50 MCQs SDT style, and we will going to do in a 85 minutes. So this is going to be your preparation and also your practice as well. So I will explain the answers at the following video. So without further ado, we just restart the timer and here we go. You are working as FY1 doctor in the medical assessment unit, seeing a Macron who is 35-year-old Polish man with a very limited English skills. So arrange the order. Attempt a brief history using hand gestures and diagram. Try to contact a member of Macron family to act as an interpreter of the phone. Do not attempt a history without a translator present. Skip the history and focus on the management on the examination investigation. Extrapolate the history based on limited finding of the ambulance crew on the initial assessment sheet. So mark your answers. Okay, so the next question. During a GP rotation, you see a Carl who would like to know the results of a colonoscopy of the CT scan after a joint MDD meeting. He missed his last appointment, but has been told the GP should have access to the report. The results identify a disseminated colorectal malignancy, although no treatment plan has been decided upon. So, read the options and mark your answers. Okay, the next one. During a busy urology ward with your consultant, the nurse mentioned that Frank, who is recovering from the transurethral resection of prostate, has admitted to feeling low over the last few months. Okay, read the answers and mark the best three options. Okay, the next one, four. You are asked to see a Jerry 55-year-old man who has recently undergone a colonic resection with a defunctioning colostomy. He wishes to make a complaint against the operating consultant as he feels that he was not adequately informed about the impact of a stoma. Okay, next one. The registrar shouts at the medical student in front of the patient. The medical student comes to find you afterwards in tears and is uncertain how to react to this treatment. Okay, the next one. You are an FY1 doctor seeing a post-operative patient with an atrial fibrillation and a heart rate of 160. Before you finish your assessment, patients start to mumble incoherently and will not follow command or open his eyes. Okay, G. 7. Your FY1 colleague takes a copy of your operating list home every evening to prepare for the following day in theater. The next one, the registrar asks you to teach two medical students who have only just begun their training. You have a long list of jobs to complete and your SHO has just called in sick. So mark your answers. Okay, the next one. Your registrar informs you that there is a peritonitic patient intubated on the intensive therapy unit, waiting to be transferred back to theatre. You have never felt a genuine surgical abdomen before and are keen to utilize this opportunity. So read the options. Okay, the next moving to 10. You are a new FY1 doctor in the surgery and have been asked to see a patient in the urinary retention that require catheter. You have only ever performed catheterization on a model and are not felt feeling particularly confident. So read the options. Okay, so next one is 11. You are driving home from your evening on call when you remember a chest x-ray that needed to be reviewed for the patient with a newly inserted chest drain. You forget to hand it over to your colleague who was taking over. Okay, so read the options and mark. Okay, moving to the next, that is 12. You are working on call covering the medical wards. The registrar asks you to place a drain in the patient with a confirmed empyema who is having becoming increasingly breathless. As a respiratory FI1 doctor, you have seen many chest tubes being inserted but have yet to place one. The registrar is very busy and will not able to help you. So, read the options and mark your answers. Okay, so the next one is 13. You're looking after the Sally who has been increasingly unwell due to the heart failure despite maximum diuretic therapy. Both you and your registrar believe that Sally would benefit from the inotrope therapy on the ITU. The patient's sons and the nurse staff feel that aggressive escalation of treatment would not benefit Sally. Okay, so read the options and mark. Okay, moving to the next one. Question number 14. You are just starting your shift as the evening on-call medical FY1 doctor and have been handed over a long list of jobs as well as answering briefs from the nursing staff. You need to prioritize the task. Rank in order following response in this situation. Okay, next moving to the 15. You are working as orthopedic FY1 doctor when you are called by the orthopedic registrar on your mobile about a patient who will be arriving on the private ward. He asks you to clerk or cannulate and initiate intravenous fluid as the patient will be undergoing an elective surgery the following morning. Okay, read the options and rank. Okay, moving to the next. A 40-year-old patient is admitted for the elective procedure on your surgery ward. After reading an article in a newspaper about statins, he tells you that he would like them to be prescribed. He is at a low risk of cardiovascular disease. So read the options and rank accordingly. Okay, moving to the 17. After ward round, you approached by one of the patients who says that they are scared and no longer want a bronchoscopy following the day. So, okay, G. Next, moving to 18. You are working in a pediatrics and have made two attempts at the cannulating a 7-year-old with a diabetic ketoacidosis. The mother is becoming quite frustrated and refuses any further attempts. Okay, moving to the next one, which is 19. You have got one doctor reviewing a patient with your consultant. The consultant tells Doc, a 30-year-old man, that he has a staghorn stone and must have an operation, which will leave a nephrostomy. The consultant leaves once the consent form is signed out, but Doc looks as he still have more questions. Okay, moving to the next one, 20. You have received several complaints from the nursing staff about Michael, who has learning difficulties and has been mobilizing unsafely around the ward. He has become increasingly challenging to manage. Okay, read the options and rank accordingly. Okay, next moving to 21. Jesse was admitted under the gastroenterology team for chronic abdominal pain. Investigation have not yielded any finding, and your consultant believes that patient should be discharged with a follow-up from the pain team. The patient and her family do not believe she can go home with such severe pain. Okay, read the options and correct best three. Okay, they're moving to the next one, 22. 6 hours ago, you prescribed IV antibiotics for the surgical patient for suspected pelvic abscess. During your afternoon ward round, you find that antibiotics have still not been given by the nurse. Okay, so read the options and rank accordingly. Next, moving to 23, your SHO prescribed a large dose of gentamicin for the patient's severe renal failure. You notice this when rewriting the drug chart. Thankfully, before this renotoxic drug was administered, your SHO thank you for stopping the prescription in time. So, rank accordingly. Okay, moving to 24. While eating lunch in the hospital canteen, you will overhear a nurse describing a junior doctor as incompetent. The doctor is readily identifiable, but the nurse seems unaffected by the attention. She is attracting from the surrounding diners. So read the options and rank accordingly. Okay, 25. Your FY1 colleague, an FY1 colleague who works on your ward consistently struggling to take a blood from the patient. These sample he has successfully obtained are usually hemolyzed. Okay, moving to next 26. You are finding it particularly difficult to work with your new SHO. She is she is condescending, undermines your management, and has often belittled you in front of your senior colleagues. So select the best three options. Okay, next 27. You have just started working on the care of an elderly ward. Despite your relative inexperience, you are certain that your consultant had recklessly discharged unwell patient many a times over a 4-week period. However, he is well regarded on the ward by the patients and nurses. You have ever heard another doctor complain about his practice? So, correct, select best three options. Okay, moving to the next, which is 28. You are clerking a young child in the preoperative admissions clinic. You note that the parents are somewhat untidy with the dirty hands and clothes. You considered what to document in the medical notes. So rank in order the following action responsible to the situations. So read the options and rank accordingly. Okay, moving to the next one, which is 29. You have just completed your assessment of a patient who is hypotensive and asked the nurse to administer intravenous fluid. You are believed by another ward to say that a patient is pyrexial. While you're taking this call, your crash bleep summons you to the third ward. Okay, so rank in order following action response to the situation. Okay, moving to the 30. You are being shadowed by the medical student while on call. You receive three bleeps quick succession. A respiratory patient looking increasingly unwell, blood cultures need for the febrile patients, and a disgruntled relative wanting to complain about your consultant. So, correct best three. Okay, ji. So the next one is 31. This is basically the part of the second exam, but we consider this is as a 31 because we want to do the complete 50 MCQs this case. Okay. So doing your own ward round, you hear a healthcare assistant HCA behind a curtain being verbal abusive toward a patient. The patient is disabled and known to have a challenging learning disabilities. The patient and the staff around the bed do not intervene. Next is 32. The patient niece is concerned regarding about the standard of the health her relative is receiving and asks whether she should make a complaint and how to go about doing so. So read the options and rank accordingly. Okay, next moving to 33, which is you review a patient in the medical assessment until you, you review a patient in the medical assessment unit with your SHO after seeing the patient and clerking them in yourself. The SHO is happy with your entry in the medical notes, agree to complete a work-based assessment for examining the patient, despite having not seen you examine the patient. So read the options, select the best three. Okay, next moving to 34. A patient whom you looked after for several weeks approaches you and hands you a check for substantial amount. She insists, despite your protest, that you take the gift for all the hard work you have done for her on the ward. So select the best three option. Next moving to 35. An obstetrics and the gynecological audit reveals that your consultant appeared to have worse mortality outcomes than a national average. You considered what to do in the light of these findings. So rank accordingly. Okay, moving to the next 36 is your consultant asks you to look after her patient, including those one in the private of the hospital. You feel stretched by the additional task and regularly leave work after your scheduled hours. So rank accordingly. Okay, moving to 37. You receive a brief from your consultant asking you to consent Mrs. Robbins, who is third on today's theatre list for an inguinal hernia repair. You have received teaching from the consultant about the theory of hernias few months ago. Although you have never seen a hernia repair, you have also a mounting list of ward jobs which need to be completed before lunchtime teaching. So, read the options and rank accordingly. Okay, next moving to 8:38. Your registrar asks you to book an urgent colonoscopy for one of the ward patient to exclude a gastrointestinal bleeding. The patient is not giving any symptoms that you feel would indicate this, and you are struggling to articulate a good reason on the request form. Okay, moving to 39. The overnight on-call SHO identifies an error on your patient's drug chart in which you have prescribed methotrexate instead of metronidazole. She has supported and corrected it before the drug was administered, but feel that your clinical supervisor should be informed. You feel this is probably due to the sharp staff shortages on the ward. So read the options and rank accordingly. Then moving to the 40. Okay, guys, we just left with 10 after this. The nurse asks you to see a trauma patient who has just become conversant on the IT ward. He wants to know whether he is likely to be able to walk again given his pelvic fracture. You are certain that he will able to walk, but unsure how long he will need to remain on the bed rest, and do not remember much else about the management of the pelvic fracture. So, read the options and rank accordingly. Okay. Okay, next moving to 41. A written complaint is made against you regarding your management of a patient who was readmitted with an obstructed hernia. You had seen the patient and felt that he had a benign abdomen, but have failed to document your finding in further detail, any further detail. The patient required emergency surgery to reveal the obstructed and incarcerated hernia, one readmission 24 hours later. So, what are the three most appropriate action to take in this situation? So, the options are. Okay, moving to the 42, we have you find yourself having not had a break or eaten anything since starting your Sunday shift 5 hours ago. You're feeling fatigued and identified that you have been become incorrectly writing a fluid prescription chart. Having corrected your error, you attempt to leave the ward for a break. At a point, the nurse in charge asks you to clerk the pre-operative elective patient who has come in a day for a surgery. So, select the best three options. Okay, moving to the next, which is 43. You're working on the gastroenterology ward and have performed several aesthetic drain insertion under the supervision of the registrar. The registrar insists that he is confident with your performance and asks you to perform one independently. Although you realize you have never actually obtained a consent for this procedure. Okay, okay, ji. 14, 44. So you reach the end of your shift on the general surgery ward and receive a phone call from the nurse coordinator informing you of a long list of jobs which she insists are completed today. You have consistently finished 2 hours late every day this week. Okay. Okay, next moving to 45, we just left with almost 9 minutes. We have to do the five MCQs. I have CT scan for orthopedic patient demonstrate a small abdominal mass for the undermined significance and neurological recommended repeat imaging at 1 month. Okay, next moving to the 46, we have you are briefed by the hospital's senior matron regarding the cod black bread crisis in the hospital. Having spoken to your consultant, she is now instructing you to discharge three surgical patients immediately. Meanwhile, you have been called to see a patient who is unwell on one of the outlying ward. So, read the options and rank accordingly. Okay, moving to the 47. You are sharing ward jobs with another FY1 doctor on a busy medical ward. After quickly dividing the tasks, you later find that your colleague has begun an aesthetic drain on the incorrect liver patient. Okay, okay, next moving to the 48. The patient relative asks you to speak with her sister, who is increasingly worried about the Hartmann's procedure and stoma formation planned for her tomorrow. So, moving to the 49. A transplant patient has attended the GP practice at which you are working, having agreed to assist you with the teaching of the group of medical student. Unfortunately, the patient appears particularly distressed as her husband has been recently admitted to the hospital despite 10 minutes of conversation remain particularly tearful. Okay, Okay, so the last one we have 50th one. The patient is readmitted to the emergency department for the fifth time in 3 months with a recurrent leg pain. The patient has been reviewed extensively by numerous medical doctor, emergency doctor, and patient GP, but patient remain anxious about this intermittent attack. You complete a full workup and establish no new finding in the context of his previous admission, except that there is nothing more you can able to offer. The registrar is insistent that you review your patient more expeditious, expeditiously. That you review a patient. Okay, so this ends our first mock, and we will discuss all the answers in the next.